Good morning, VA Sierra Nevada Healthcare System. I'm really pleased to introduce Katina Campbell this morning. She's a social worker at VA Sierra Nevada Healthcare System and leads a very important program. A topic that many of us maybe feel uncomfortable addressing, intimate partner violence and its impact on our health and well-being and impact to healthcare. Good morning, Katina.
Good morning.
Wonderful to have you here today.
Thank you so much for having me.
So tell us a little bit about you and how you got into healthcare.
Well, I graduated with my master's in 2009, and I was working in the private sector in mental health for a number of years, but I've had the privilege of knowing several clinicians who are amazing, who always talked about the VA and who always promoted how wonderful the services were here and the amount of good that was being done. And so I had the opportunity to interview and come over, and I started working in the Healthcare for Homeless Veterans program, and I was there for about 4 years, and just recently became the Intimate Partner Violence Coordinator. And my dad is also a Vietnam veteran who gets services here, and he's always gotten amazing care, so I'm very happy to be a part of the VA and be able to work here.
What drew you to social work?
I've always wanted to help. There's always, ever since I was younger, I always knew that I wanted to be in the profession where I could help and try and do my best to affect change in a positive way. I've been involved in situations where throughout my lifetime I've seen so many different things in regards to how mental health, substance abuse, and different things affect my family members and friends. So it's just always been an area where I knew I wanted to work and make change.
You know, it's wonderful to see how openly previously taboo topics were in healthcare. You know, drug, alcohol use or abuse, mental health issues and concerns, violence, intimate partner violence. What is intimate partner violence?
So intimate partner violence is any violence that is physical, verbal, psychological, stalking that is meant to cause harm. It can take place in current relationships or former relationships. It can be dating acquaintances. It affects both men and women. It's involved in heterosexual or same-sex relationships, and it occurs on a continuum of frequency and intensity. And the language has changed from intimate partner violence from domestic violence because domestic violence basically encompasses any violence that takes place within the domestic sphere within the home. So, and we have policies and procedures to address that, which usually involves child abuse and elder abuse, but not so much policies that involve intimate partner violence and how to address that. So that's basically how the Intimate Partner Violence Assistance Program came about.
What is the typical presentation of intimate partner violence? What form does it normally take?
It can take various forms. So usually it starts off with emotional violence, which can involve verbal abuse, threats, being any type of harassment or causing psychological and mental harm to someone. Then you've got the effects of physical, which is what we typically think of when we think about intimate partner violence. But it's not just hitting and choking and things that cause physical harm. It can also cause physical effects, such as gastro and issues, physical health issues, female health issues, so various different things in regards to that area. And then you've got the situations of stalking, which is actually the area that causes the most harm. because that can be done in various different ways, as far as through social media, texting, and it also is the area where it causes the most emotional distress because your partner can be threatening you in regards to not just harming you, but also harming your family and other family members. And then you've also got sexual violence, which is also a very concerning area.
When you have a partner who is on the giving end of this abuse, whether it's verbal, emotional, physical, stalking, various forms of harassment, do you find that typically they were subject of abuse in their lives, or how does that start? Is it truly a chain event?
It can be. One of the areas where it's demonstrated in the research is that intimate partner violence occurs on a continuum throughout the lifetime. And you find that especially in the veteran population, they are twice as likely to either use or experience intimate partner violence. And that starts from pre-military, during the military, and after the military, and occurs throughout the lifespan. So you do see where people who are involved in intimate partner violence have had childhood trauma, have experienced or seen domestic violence or intimate partner violence as a child. And there are various factors that aren't necessarily contributing factors, but risk factors that increase the likelihood that they'll be involved in intimate partner violence.
If you have a veteran that comes to a healthcare provider and says, I'm experiencing some form of violence, how do you work with that individual to help them manage themselves in that situation?
So what's unique about the Intimate Partner Violence Assistance Program is that it's set up to go through the process that's going to be the most protective of that individual. So ensuring that they have a very safe environment to be able to go through the screening process, which is the initial step in regards to identifying anybody who is experiencing or using intimate partner violence, and ensuring that they have the availability and the safe place to be able to have that discussion and go through the screening process. And then ensuring that we make sure that they have access to resources and information, educating on and making sure that there's awareness of what intimate partner violence is. When I first started in the program, which has been all of 3 months now, but I got a lot of, what is intimate partner violence? What are you going to be doing? So there's not even a lot of awareness that we even have the program. And then once they go through the screening process, and if they're identified as being at risk or currently being involved in the situation, we don't just send them away with just information packet and that's it. You know, they get immediately connected to myself so they can get more direct services. Part of my responsibility as well is to make sure that I'm building partnerships within the VA and within the community to ensure that they're able to get access to services that we may not have, such as shelter support or advocacy groups or various things like that.
So if a veteran presents and says, I'm using violence in my relationships and I want to make a change, how do we respond to that?
So currently, what we want to do is make sure that we are very veteran-centric and person-centered, and that they know that even disclosing that information, that it's safe to do that, and they're not going to be penalized for that, and that the purpose of the program is to be available to help and provide services. So one of the areas that we're trying to build as part of the program is to get a Strength at Home, which is a treatment program for veterans specific who are using intimate partner violence. And they can, if we're able to get that program implemented, they can be referred through various means. But we also want them to disclose that information so we can get them connected to services to help provide some intervention. And whether that be mental health and counseling, whatever may be the contributing factors that are helping cause the use of intimate partner violence, make sure that we get them connected to services as soon as possible.
So this month is a public awareness campaign to talk about intimate partner violence. Talk a little bit about that.
This is also White Ribbon VA Awareness Month. Usually White Ribbon VA is done in the month of April, but it was strategically aligned with Intimate Partner Violence and Domestic Violence Awareness Month. And basically, White Ribbon Campaign is the most well-known campaign to promote awareness against violence against women, and to give opportunity for individuals to make a pledge to stop harassment now, and to not condone, to not endorse or stay secret or quiet about any harassment, sexual harassment, or domestic violence that they are aware of. So there will be multiple opportunities also throughout the month to take the pledge, to be a part of that, and to promote the awareness for White Ribbon Campaign as well.
How do veterans reach you?
They can reach through their primary care provider if they're involved in mental health. We also have website information and contact information, and there's also information to where they can call the National Domestic Violence Hotline and be connected to any intimate partner violence coordinator in their area.
Thank you, Katina, for spending time today talking about a very difficult subject, and one that reaches in to the intimacy of our homes and our most intimate of relationships, our partners, our husbands, our wives. It impacts everyone in the household, and certainly healthcare is a resource for all of our veterans who are either using or experiencing violence in their homes and their intimate relationships. We want you to feel comfortable to reach out, ask the question. We're here for you, and we have so many resources available. We're going to show a very quick video that illustrates all of our key healthcare managers, service chiefs, clinicians in our healthcare system standing up and saying a few words about how violence impacts our delivery of healthcare. We'll be very clear that we're here to support and provide healing to anyone involved in a relationship of this type. Stay tuned. I acknowledge that sexual harassment, sexual assault, and domestic violence are not acts committed exclusively by men.
I also recognize that statistically these acts are committed by men far more often than women. We need to own it.
I see the impact of abuse in my work as a healthcare provider. The health consequences are significant and lasting.
That's why I pledge to never commit, excuse, or stay silent about sexual harassment, sexual assault,
or domestic violence against others. I promise to honor VA healthcare settings
as safe and welcoming environments. Recognize touching or comments that may make others feel uncomfortable,
such as commenting on appearance or calling others baby, honey, sweetie, hottie, and sexy.
Talk to others in my life about the repercussions of unwanted hugging, touching, or flirting.
Understand that some veterans and others may have invisible wounds and experiences that I may not fully understand.
Lead by example through my thoughts, words, and actions.
Treat all those we serve and with whom we work with dignity and respect.